Good. So we'll begin now. Good afternoon and welcome from the Global Healthcare Management Program at the GBSH UCL. I'm Dr. Shaila Zaidi. I'm the program lead for Global Healthcare Management across the three routes of finance, analytics, and leadership. And with me is my colleague, Dr. Rama Prasad Kanungo, who is the route lead for Global Healthcare Management Finance. So we are both delighted to have you here with us today in this taster lecture for GHM Finance. Just to let you know that the session will be recorded and a recording link will be shared with you subsequently through an email link. You can type questions in the chat box and we will circle back towards the end of the lecture to pick up your questions. Dr. Rama Prasad Kanungo will also provide a full slide deck for students who are interested. So again, we're very excited to have you with us. Just before we start, I want to just point out that in the program, we have a number of modules and a wide variety of taught content, which ranges from global healthcare management principles and tools to healthcare systems, economic evaluations, and then, of course, the specialist finance-related content, which is so important to this particular route. So I am going to now hand over to Dr. Rama Prasad Kanungo, who is the route lead for finance, but I just want to take a minute to introduce him. He is an associate professor of finance at the UCL, and he has undertaken extensive interdisciplinary research in finance, cross-cutting, business, institutions, innovations, markets. So there's a wealth of research there, and he teaches one of the modules. He's a lead for the risk management module and also convenes across all the GHM finance modules. So Rama, over to you. And we're off with the start of this taster lecture.
Thank you, Sarah. Thank you, Lauren. And thank you, guys, for joining. Okay, you are most welcome to our tester lecture session. What it is, I will tell you briefly how we actually teach at UCL GBSH. Our teaching has a component called flipped classroom approach. 1 hour learning materials will be recorded and uploaded on your VLE, virtual learning environment. We use Moodle. And in addition to that, there will be in-person classroom contacts with you where we will have our slides and we'll have different interactive activities during our lecture. In addition to that, you have your seminars, workshops, quantitative extra classes, guest lectures. It's a combination of elements to put together for your teaching and learning. So what I'm going to do today is to share with you some of the teaching materials. It's just a kind of an introduction to what we teach, to give you a flavor, to give you an experience. So what we'll do, let's share the screen. I'm still seeing only 3 of you. Let me share the screen. Yeah, okay. Can you guys see my screen? I think so.
Yeah, I can see that one.
Okay, so this is what we're going to do today. It's a very brief introduction to health financing. Since it's a finance route in your program, I have combined the health and financing, which is a very critical element of your learning. While you're learning finance within this program, you have common modules where you study the health policies, health applications, health implications, part of leadership, part of marketing in there. But the focus of this program is on finance. And on finance, we have risk, we have capital market, we have economic evaluation, we have accounting and financial reporting. So it's the specialized elements or components of this program. are a combination, wholesome combination of finance, which will help you to be a better decision maker in future. If you want to go into industry in terms of health industry, don't think health industry is limited to pharmaceutical company, biotech companies. It's extensive in anywhere you can work, from venture capital to crowdfunding on artificial intelligence. And you probably know that we have an artificial intelligence and finance module as well running this year. So I'll move on to the next stage. These are your learning objectives for today's presentation. This is indicative what you are going to learn. So we have 8 different elements subsumed within this presentation. So the first thing I would like to take you through is what is the health financing in two terms, like World Health Organization reports in 2010. You might say, why 2010? Because this is the most apt definition I found on a World Health Organization within the last 10 years. So what it is trying to tell you is for all in terms of it includes 4 constructs: prevention, promotion, treatment, and rehabilitation of sufficient quality, so and to be effective, so without being exposed and suffering from financial hardship. If you look at the World Bank, World Health Organization, World Bank data, that is a data set. I hope one day I will be sharing that with you to show. You can see the out of pocket means the people pay from their pocket. The expense is almost 64% in emerging world compared to developed world. This is one of the big concerns. One of the papers we have done recently, we're looking into that. So the whole idea behind this financing system, health financing, is to bring 4 elements to the people with quality and effectiveness and provide them in such a way they would not be exposed to the financial hardship. So the second bullet point, you can say say that this is what basically the quality element of health financing. So this hyperlink, healthcare finance spending, it's here. When you will have the slides, you can click on it and go into that. It's from the Oxford University data center. It's called Our Data World, and they are in linked with Harvard. Harvard University Medical School as well. They collect data all over the world, and this health spending will tell the percentage of countries spending on healthcare in terms of their GDP. So this basically tells a country's overreaching ambition or commitment to bring uh, equality, equality to the people, those are less access to mainstream health, and to bring with the quality and effectiveness and provide them support. So this is the basic definition of financing. But when you're writing an exam or your assignments, you are not supposed to just write the definition. You have to critically interpret that when and where necessary. I and my colleagues will tell you when you will be writing assignment and your exam. We'll be standing by you to tell. We'll have different. There is a question in chat. I can see. Do you have to take it now, or can I take it later, Lauren?
Sorry, that was just me encouraging
Oh,
people to
that's you. Let me
type
check.
questions. So you carry on, sorry.
Okay. So the next one we will be doing, this is an illustration how universal health coverage goals. Why are we focusing on universal health coverage? It's important in terms of giving the equal contribution, equal access, equal support, and equal benefits. For all the people, we need health support. We all need health, actually, at some point in our life. So this is taken from our world our data in world website. So basically what we do, we create the revenue, raise the revenue. This is the creating the resources, how we will direct the fund in such a way it's equally applied to the different areas we want to enhance or improve. So first thing we do, you raise the revenue. Revenue is the income generation. Then we pool the different sources of funds together. then you do the purchasing in terms of, it's an accounting term, how we provide the delivery in terms of oversight and governance. So putting them collectively, the benefits will translate into three things: health equity, due to allocation of equal funding; efficiency, how effectively it is been distributed through different channels; and then nexus to the relationship with the health outcome; and the transparency and accountability, how transparently and accountable the funding allocation has been made. If you look into, we done a recent, we did a paper during COVID, and part of countries we studied is Brazil and India and Mexico. We had 14 countries. The three countries, we looked at the peripheral areas, though the tangential health benefits they receive. Except Brazil, Mexico and India was massively struggling during COVID, only because of their devolved healthcare system. In simple terms, what happened? They focus into the major areas, and the peripheral areas in their countries are being affected because the lack of access, lack of fund, lack of distributions, and lack of engagement. India was suffered more compared to Mexico, whereas Brazil used a system called Sentinel system. They used that in 1990s in malaria in South Africa. And that Sentinel system is very productive in terms of providing equal access to funding. We cannot discuss that Sentinel system here in length because we don't have time. We'll do that in classroom. I'm hoping to see you all. So we'll do that. Okay, so this is government spending. The one other thing I was trying to refer to, which is the percentage of GDP, gross domestic product, from 1980 to 2023, is a massive window time period. And health spending, each government, what is the percentage? In 1880, it was 1% of the global GDP was spent on healthcare. In 1880. In 19th century, it was only 2%. And currently, Germany spends 44%, UK spends around 43%. Sweden, Denmark, they're all in the top countries spending a lot on healthcare system. Why should we know that? Because this will give us the understanding that how financing could be critical and instrumental in changing the public health. Okay, you can watch this video now.
We do this all the time in other industries. Hi, my name is Andrew Lowe, and I want to welcome you to 15482 Healthcare Finance. Now, you might be wondering, exactly what is healthcare finance? So let me start by telling you a personal story. A few years ago, a number of friends and my mother were dealing with various kinds of cancer, and in my mother's case, the standard treatments weren't working. So a friend of a friend introduced me to a very successful biotech company that was developing a number of new cancer drugs, including one that might help her. I was privileged to meet with the chief scientific officer of the company, who brought along his chief financial officer, because I guess he was told that I was a finance professor and he thought he might need a translator. During the course of our meeting, I asked what I thought was an innocent question. I asked them whether their sources of financing had any influence on their scientific agenda. As you can imagine, I was very interested in how they prioritize their agenda, since one of the projects was related to the kind of cancer my mother was battling. I'll never forget his answer to my question. The chief scientific officer shook his head, looked at his CFO ironically, and then turned back to me and said, "Influence? Our financing drives our scientific agenda." Now, I'm an economist, so I do get it. You have to pay for stuff. But as the son of a dying cancer patient, I was absolutely shocked and outraged. What do interest rates, stock market volatility, and Fed policy have to do with whether you should treat cancer via angiogenesis inhibitors, immunotherapy, or radiation? Nothing. And yet it drives their scientific agenda. Now, I'm no biomedical expert by any means, but should the science be driving the financing instead of the other way around? Well, that's what this course is about. That incident convinced me that finance actually plays a huge role in healthcare, particularly in the drug development process. One of the things that I learned early on is that this process suffers from a triple whammy of challenges. Number one, it takes a long time to develop a successful cancer drug, in some cases 10 to 15 years. Two, it costs a huge amount of money, on the order of hundreds of millions to billions of dollars per drug. And three, the chances of failure are extremely high, especially in oncology. This trifecta of challenges means that investors aren't going to be as keen to invest their capital in this process, especially when there are more attractive investment opportunities in other industries. But here's where healthcare finance comes in. What if we use the tools of modern financial engineering to reduce the risk and increase the rewards of biomedical investing? We do this all the time in other industries and contexts. For example, if you have any kind of savings or retirement account, you're probably holding some of your assets in an index fund, which is a portfolio that contains literally hundreds of stocks, like those in the S&P 500. If you do invest in such a fund, congratulations. You've taken advantage of one of the most basic and important ideas of modern finance, diversifying your investments across a large number of stocks instead of trying to pick one or two winners. Well, the same approach can be applied to drug development projects on a massive scale, and the same kind of financial benefits should emerge. And if we use all the other tricks of the financial trade, portfolio optimization, collateralized debt obligations, credit default swaps, and derivative securities, we can attract much larger amounts of funding to develop the miracle drugs that desperate patients are waiting for. Now, you might be scratching your head right now and wondering, really? Is this really wise? After all, didn't these tools figure prominently in the financial crisis of 2008? Well, I have to tell you that it was studying the financial crisis that started my thinking along these lines. The financial crisis didn't happen because these tools didn't work. It happened because these tools worked way too well, channeling tremendous amounts of money in a relatively short period of time into US residential real estate. In fact, Warren Buffett called some of these tools financial weapons of mass destruction. And he had a point. There's tremendous power locked up in global capital markets. And when that power is unleashed carelessly and irresponsibly, financial engineering can cause great devastation and disruption, with fallout that can linger for years. But the analogy cuts both ways. When powerful tools are used carefully and responsibly, financial engineering can provide virtually unlimited resources to fuel innovation and economic growth for generations to come. The more you know about finance, the greater the chances are that you'll be able to use these techniques properly, responsibly, effectively, and ethically. That's why my colleagues and I at MIT created 15482 and this online course. Over the next few weeks, we're going to cover financial concepts.
Guys, I stopped there because that video goes into the particular course they have in MIT. The reason I wanted you to watch this video is to get a sense how important is finance in terms of health, drug development, drug testing, trial, and bringing innovation in terms of disease management, equality in care and social, creating an advanced social capital in terms of health. So I believe you like that video, and that gives you a sense how finance is instrumental, is critical in the center of healthcare financing, in healthcare economics, and in management of health. It is over embracing. It is like an umbrella concept covering all aspects of health, like the guy in the video was saying that it's equal. It can reflect the same way as it is done in capital market, like derivative markets to CDAs to swaps to options. You can use the same technique, same kind of financial instruments to enhance the healthcare system, public health, population health, and social health. Then that will enhance eventually the social capital where people bond together and share and created that cohesiveness, which will be very important for you in future term when you are working in large companies managing hundreds of people. So you have to understand that the human side is very important as well, which comes through the passage of finance. So, okay, so now we go to the next slide to look at the different sources, different funds, how it comes to health financing. So the one important is the government funds. So through different taxes, social health insurance, and many other sources they provide to the healthcare people, the primary healthcare system, to healthcare governance as well. Then the people come into the picture are the private insurance people. So here it based on the employer based on individual plan. If it's going through a company or organization, it goes through employer based, or you can have individual plans. A lot of emerging countries they have trying to have universal insurance system to stretch the health access to peripheral special areas in their countries in the states. So the other one, which is a time-tested model, is out-of-pocket payment. Even the patients do pay directly to the healthcare providers, and that's is a demanding and very difficult situation for emerging countries like the names I was telling. India, I have direct data and experience in there. So those kind of situations, out-of-pocket payment is not a preferable choice, but these are the sources of health financing. So the other one is the international aid and donations from global World Bank, World Health Organization, International Monetary Fund. These are the large agencies in the world agencies. They step in to help the country level and national level health. Country level means they give to the central government, they distribute that because they have a devolved healthcare system, or they give it to different states in a specialized funding vehicle. They use a different funding vehicle and they give it to them. So this is another thing we'll discuss when you come to my class. So these are the four common health financing model. When I will share the slides with you, go to the hyperlinks and click and go there and see what are they. I'll briefly tell you, this is a Bismarck model, the oldest model in European countries, which covers the universal healthcare for the people. And this model was done by Bismarck himself. It's in Germany. It's gives the insurance based. It gives the access to employer and employee contribution. The other one, beverage model, it's an UK person, UK scientist developed that. It is tax-funded national health services, which when you come to UK, you can see that UK health system, which started in 1948, NHS called National Health System, follows that this model. The other model, which is a failed, it was developed in USSR, Samansko model. It's never worked well, but this is one of the model in uh, uh, liberated Russian countries, not the pre-revolution, post-revolution. This is a model, but did not work well. And you read that article, you will find more details why it did not work, because of the Unitarianism stopped the social benefit of the model. So the other one is our this model is our called national health and insurance model, is a mix of both public and individual. An out-of-pocket model is no universal coverage, individuals pay directly. That's not something is desirable and people want. So there are certain things we will also look into when you will come here. I'm trying to give you a flavor of everything as much as I can in this presentation, which will be similar to your classroom presentation on your recorded videos and Moodle. So there are four different types of models we use to quantify the health financing. One is the actuarial model, which is based on insurance companies. How they do that, what they do, they take the cash flow and use it with different variables, data points, to see what is the optimal insurance payment a company could potentially arrange for people. So this is how a quantitative application of health financing. The other one is cost effectiveness analysis. It's quite early. In 19th century, it started developing the cost effectiveness analysis. One of our modules have that already in there. In health evaluation, you will see that cost effective analysis. The how cost is per unit cost of medical spending is adding the benefits to the patient. There are many techniques in there. The other one is our simulation model. They simulate. Traditionally, they used to SQL. SQL is structured query language. Now you are a large modern language, large modern machine learning language which is our artificial intelligence. So simulation model used to, they take the data, sanction it, partition it, train them, give them different runs, then decide the nodes, and eventually they set that into the model and the model runs. SQL is 1960 to 2000 run. But now we are in the age of artificial intelligence. So what we do now, we use predictive. That artificial intelligence could be four types. One is a generative, which is the very basic one. So Gen AI is a basic AI. Then comes descriptive, which will be able to generate and describe. The next one is predictive. This will be able to predict. And the last one, the most advanced, which similar to our brain, is called cognitive analytics or cognitive AI. So Gen AI is sufficient to this stage to look into how the things work. So what do we do? We take a natural language system, machine learning. For example, we take neural network, and we train the neural network with different partisans, different training, different subsections, different nodes, different sigmoids, different orientation. Then we run the data in there, and it tells you with 98% accuracy that what kind of financial support we can distribute, what could be the fund, what could be the channel, who should be the receiving that most. I have a paper recently we done that use this technology, this technique, which is a multi-layer perceptron MLP neural network to predict the patient outcome, to predict the financial challenges. You can use for multiple things. We can do that in classroom when you have time. I'll do that separate. Okay, I run a couple of separate quantitative sessions. One I do for your risk assessment, which is called Cox proportion hazard model. That is a must. We must do that. And we learned something like using neural network. Although you might study that in AI and finance, if you have taken that, but I will run it briefly. Then we'll run some of the BVA. This is macros. We'll create some macros in Excel and run through them and see how it works. It's always interesting to see in real life than just telling you narratives. I'll do that. Then the most common and traditional one is the regression models, where when you can take multitudes of data in different ways and put and run it. But remember, regression model could be different. There's plenty of regression models there. The simple, multiple, binomial, trinomial, multinomial, forest tree, decision tree, plenty. We'll see that when time comes. That we'll do this one as well for you, whichever is appropriate depending on what data we have. So now our focus moves on to out-of-pocket expenditure in 2022. It's taken from World Health Organization 2025 data. You can see the darker ones are spending less, and lighter ones are spending more. So this data tells us the unequal distribution of fund or finance across the world. There will be always a differential to flow the things up to down, but remember that the whole idea of global community is to bring equality, like World Health Organization and other agencies. Our ambition and aim, and also the GBS also want to bring in the equality into the world in terms of whatever small contribution you make. Doesn't matter, we'll make a contribution, and you are our ambassadors to bring that contribution to the real world. In future, you'll go to the real world and bring some drugs. You bring a financial model which will reduce the drug development cost, trial cost. It could be possible. It's not impossible. It could happen. So the reality is that you go through this process to bring the equality to the world. Make the right decision. You will be right. You will be trained here to have the right decision, which you will implant, which will apply into your context, your business context, your if you're running your business or where you're working in that context. So out of pocket is one of the critical challenges, issues, and barriers in healthcare financing. So you can see these are very simple, self-intuitive to read and understand: raising healthcare costs, inequality in access to care, financing sustainability, balancing public versus private sector involvement. One thing I would like to highlight though is financial sustainability. Nowadays, you probably know ESG, environment, social, and governance factors are combined into finance, combined into healthcare. ESG is everywhere. So what we do here, we also measure the impact of ESG on using financial tools. Recently, we have a paper which we still working preparing it for submission. It's based on entire ESG and health financing. So basically, the sample is collected in terms of how health financing is working. But what we have done, we have applied ESG into that. So what we have done, we have divided the people into four groups, in four quantiles. So we applied a regression called quantile regression. Like I said, there are plenty of different regressions. It's one of the regressions. So what we did in that, we decomposed the group into four quartile: quartile 25%, 50%, 75%, and 75 plus up to 100. And also we divided ESG into three components: E and S and G. And we look into different combinations in each in quantile and see what's happening with that. So sustainability is becoming an intelligent choice, by intent or by choice. It's all over there in healthcare, and sustainability is also very important in terms of finance. How it is that we done a recent paper again on that's green bond and ESG. This is a second paper. So ESG and green bond is what we're trying to see how what is green bond? Green bond is a bond which is attached to sustainability. The money raised through the bonds will be used for sustainable green projects. I believe you understand what is bond is, correct? So on that assumption, I'll proceed. I will explain. Okay, let me add just one line. Like we borrow money from banks, institutions, agencies like government, companies, municipals, their councils, they borrow money from us. And they issue a paper called bond. That is how bond is works. Okay, it's a reverse way of borrowing money of institutions, government agencies, and municipalities from us. So so the green bond is very important in raising finance, and there is a billion industry, 64 billion industry in USA currently going on green bonds. So green bond and financial sustainability through health financing tied together. They're like siblings, brother, sister, brother kind of stuff. So you can see how important that is when it comes to know how these sustainability is coming through different channels, bringing the financial benefits, which is to not to give hardship and overexposure of financial demand when you are seeking healthcare support. So this is very important. They are all interconnected. ESG is an interesting aspect. If you study here and do a research project, you can very well look into one of the ESG areas. That's data is also easily available. Okay, I'll go on forward. So this is our universal health coverage. The definition is everyone having equal financial coverage, not to face any financial hardship. So these are the four elements to that: improve public health, prevent financial hardship, boost economic growth, and reduce inequalities. Inequity in healthcare, public health is a prominent thing. So real allocation of an efficient allocation of funds will reduce that gap and create social harmony. There is a theory of well-being, and supported by many other theories, such as institutional theories and RBS, were research-based view, and we have technological acceptance theory. We have institutional theory. I did say that. We have many other theories. Theory of social capital. They all come together with well-being kind of theory. So they actually explain to you numbers are good, calculations are good, equations are good, but how we will understand what is going behind these numbers? So we need theory. They are truly married to each other, theory and quantitative. They are married to each other. They are incomplete without each other. So we need to theory to support what we envisaging or we seeing in our mind and writing the equations. So the funding mechanism supports universal health coverage. So there are some countries they're doing very well, and some countries they're doing well. Some countries yet to catching up, and some countries are not doing well. So in our next project, what we're doing, our research project, I and a couple of my colleagues from different places from South Africa, we collecting a large longitudinal panel data from South African countries. We're starting with South Africa, and I have a meeting with my colleague from Johannesburg University tomorrow at 1 o'clock, same time. So we're going to discuss how we can get that data and see what's happening in African and sub-Saharan countries. That's the area not enough covered. So I just told you that those kind of little bit things, when we do them in the classroom, we'll bring in the real data and show you with time permits. Don't ask me after that, we need more, you need more. We'll do few, but not enough. That will be enough. We won't do that over. We'll do enough. Okay, so these are the countries doing very well. Like I was telling you, Brazil was doing one. They have a sentinel care system. They adopted that from South African malaria-prone countries. Costa Rica, I have not done anything in Costa Rica. Currently, we're doing with South Africa. South Korea, recently my colleague has come back from South Korea, collecting data from 6 hospitals and with meeting with all AI people in hospital, robotics and technology they're doing in South Africa. So we're meeting next week to look at the data. It's all recorded interview data to see how it's working in South Korea. These are taken from World Bank Group 2015. And the role of private sector in health financing is extremely critical, PPP. I think this is a growing area in India, as far as I know, in some of the other Asian countries. I believe Pakistan is one of them. The public and private relationship partnership bringing in more critical health sources to design the medical device, creating the drugs, trialing the drugs, creating the right infrastructure for healthcare. So these are the very important parts for private insurance companies, pharmaceutical companies, and partnership, bringing together the benefits to the people. So this is another video. This where it comes, the innovation in health financing strategies, the social health insurance reform, and PPP, which is public-private, result-based financing model. What is the result-based financing model? I'll just briefly tell you. What happens, a lot of private companies issue bonds. That bond is backed by, supported by government, but that bond's ambition is to bring some defined health benefit to a group of people. For example, you will say will reduce diabetes in Asian community in that area by 13%. And the bond will be issued to on that purpose, and people will buy that bond. Hi, Ram. Hi, Law. Where is Law? Is there a message? Are we running over the time? Is that one?
No, I think you're fine to
Which,
carry on.
shall I carry on?
Yeah, all good.
Okay, so the results-based financing model is the private companies issue bonds, and the bonds are having a targeted outputs, 3 targeted output. You will get the face value for any of your coupon rates in that. I'm booking a student to support your session. So yeah, so we do that. So what happens with that? I lost it. What I was saying. Yeah. So yeah, as long as the bond is achieved, the targets are achieved by the bond money, the government will release that money. Government, yeah. Thanks, Lo. Government will release that the money to the private sector. There is a channel mechanism. There is a diagram. I will do that. No, I don't have preference. No. So digital payment system improving efficiency. Then the other one is a digital payment system. Actually, we currently looking quite a lot into this. Why are we looking at this? Although there is a digital system already in many advanced hospitals, but there is an extreme asymmetry in there. We notice. Even in some of the Eastern European countries, they are suffering from that. So digital payment system is not fully integrated. It's still using the silos where the traditional payment system or the digital payment system you see paying by card, it's not actually the fully integrated digital system. You paying a digital way, but it's not the digital payment system integrated to the entire system of the hospital or healthcare companies or primary care. The most significant neglected system of this is the primary healthcare sector. Particularly in emerging countries, they are badly suffering from digital payment system. So this video will give you a slight relaxed view about how it works. It's not very detailed, but it will give you a relaxed or maybe a introductory understanding. It's not very
basis. Yet mobile wallet use.
Why you gone there? Go there. Start.
When's the last time you used cash? Literally pulled a wad of bills from your pocket in exchange for a latte, a new pair of shoes, or your share of a night on the town. For most, it's been a while. There's no reason to carry cash. In many cases, you don't even need a credit card. Your Starbucks app will buy that latte. Apple Pay can take care of some sneakers. You can handle your share of a night out through Venmo before grabbing that Uber or Lyft home. And you always know exactly how much you're paying before you commit to any of it. But best of all, none of these transactions require reaching inside your wallet or contact with another individual. Last year saw the biggest rise in mobile wallet spending, non-debit or credit card based, at over $6 billion. And payment researchers expect a lift of 10 to 20% in contactless options, like Apple Pay, due to the COVID crisis. Yet mobile wallet use is basically non-existent in the current healthcare system. It's now more important than ever that the healthcare industry catch up. The U.S. healthcare payments market is massive. Total expenditures hit $3.65 trillion in 2018, was expected to rise another 5.4% in 2019, and COVID is sure to make 2020 land far beyond expectations. All while 90% of healthcare providers are still leveraging paper and manual processes for payment collections. On top of that, increased automation in the personal finance realm has had an effect on people's ability to understand traditional medical billing processes. Last year, 70% of people were confused by their medical bills, and 90% had expressed some level of concern with unexpected costs and their ability to pay. Also, 77% of providers said that it took more than a month to collect any payment, and most hospitals only expected to receive about 75% of the billed amount. In short, healthcare is missing a huge opportunity by doing things the old, time-consuming, prone to mistakes, and very untransparent way. We can do better. We'll have to do better. Providence's Digital Innovation Group is working hard on that very thing, making collecting and paying medical costs immediate, transparent, and contactless. Creating a system that caters to patients' individual needs, getting them accurate information and pricing transparency right in a transaction-ready environment, all while reducing waste and stress and increasing safety, things that are more important than ever as we continue to manage in a post-COVID world. No more snail mail invoices, no more surprises. Healthcare's current payment system is holding back its ability to deliver the highest quality, transparent care. But our Digital Innovation Group is on top of it. And while we feel sorry for those snails and those lonely ATMs, they'll be just fine. And we'll be all the healthier. Learn more about Providence's digital.
Okay, guys, that's the Providence company. The video I wanted to share with you to have the data to see, although it appears in big cities and big countries or advanced countries, that digital payment is well integrated into the healthcare system. In reality, it is not. In other countries, it's most mobile payment and some sections of digital payment randomly not integrated. The reason is that they're excessively expensive to have the entire integration of healthcare system. So the role of health financing comes into this picture when you see that something is excessive, what we can do in terms of studying finance in future when I will come out from this program and study what could potentially I do to bring down that cost. You are in an industry, you are working in venture capital, you are working in healthcare, you are working in financial company, you are working in biotech company, you are working in pharmaceutical company, or you are working in academia. The whole idea is to bring something called impact. How you are going to impact that to people, and the whole idea is to provide that equitable finance support, financial support to our people, our patients, to our public, our countrymen. So it is very crucial, this program, and it's one of the most charming program, I would say, because I teach here. Probably I love this, and I will be very happy to see you all over time. But for now, let's do this one. Can you please take out your mobile phone or mobile devices and scan this QR code? Once you do that, there is a small quiz. Once you all done it, I will stop sharing and I will we'll go through the quizzes, and I will be collecting your response through your mobile phone. Okay, so what I will do, I will stop sharing this one. Have you taken the scan of this QR code, all of you? I'll leave it for a minute to take all of you scan of this. When you scan, you go to a multiple choice question page. Okay, so I will stop sharing now, and we will do the okay. Are you guys ready to do? Can you start answering the first question? What is the primary objective of the healthcare financial management? I can see your answers here if you do the answer the questions. Or I can share the screen as well with this one. No. What's happening? Can they not do the? Is there a problem with?
I've just scanned the QR code and it says, thanks for joining, view the results. So I'm not sure if it's on the wrong slide.
Okay, I'll do the. No.
Oh yeah, it's back. It's there now. And I've also shared the link in the chat. If anybody's already on their phone, they can just click the link.
Yeah, guys, the questions are in front of you. You can select the answer and it will show on the screen here. So I'll be waiting for your response. One is the right answer. Okay, what about the other 6 people? Shall we wait for you or shall I move on to the next slide? 2. Three. Okay. Okay, let's try the next one, guys. Which of the following is considered a direct cost in healthcare? Have you studied beta finance before or accounting? There are 2 costs, one direct and the indirect cost. Direct cost within this system, administrative salaries, medical supplies, rent for properties, expense for marketing. Don't worry, answer it right, wrong. It's not an exam. We just to have some fun to see how it goes. Anyone else? 3 medical supplies. Okay, we'll see the results in the end. So thanks guys again, 4 of you. This is what is the purpose of capital budgeting in healthcare organization? To monitor this and that. Short-term cash flow is a bit difficult. Do you find this difficult questions? So we can skip a couple of questions. We have 9 questions. You can tell me, 10 questions we can skip through. Okay, try to answer this question and see if there's nothing to worry much really. Do you know what is capital budgeting, isn't it? How the capital is budgeted in your company, that is, capital budgeting is based on different 2 theorems, BB theorems and MM theorems. So you will see that over time, but capital budgeting is basically, in simple terms, how the capital is adjusted in terms of the rate of tax, the rate of capital is taken out from the capital and how it's going to help in terms of allocating different funds. Try this one. Okay, let me skip this one. Let me find okay. What is the key reason for the rise in healthcare costs? You must answer this one. It's very obvious, this question, the answer. Anyone else? Yeah, more? Okay, great. Anyone else would like to try, or you want to go to the next step? Yeah, next step. What type of financial statement provides as an healthcare and financial position at this specific point of time? Okay, it's very a financial question, but if you want to skip that, I will skip that. What is the what of the following is a common method used in healthcare setting to control cost? You can answer that easily. It's an intuitive question. You don't need to know a lot actually about health financing, healthcare, anything. The answer is obvious. Out of 4, 1 is there. Try this one. Let's see. Or you find this one okay. Outsourcing administrative functions. Next, anyone else? Expanding services line. Okay. 2 there, increasing staff salaries. 2 in there. 2 in here. Okay. Let's go to the next line. Okay, now don't approach that question. That's a difficult question. That's also difficult. So, which of the following is not typically considered a source of healthcare revenue? That is, this question also very intuitive. You can easily pick that one in the answer. Not the healthcare revenue. Anyone else? Anyone else to this question? Okay. So following the common strategy is well okay, so what we'll do is stop it here. Yeah. View results. It will take some time. Yeah. So this is, can you see my screen, guys? I'm showing you the response and the results. This one is provide quality care while maintaining financial stability. The second one is right question is medical supplies is the direct cost. That's all you have done correctly. Expense of marketing, we did not attend that question. What is the purpose of capital budgeting? To allocate funds. That's the right question. Sorry, right answer. The technology is the right answer. You have done that, and this we skipped. So overall, although you are only 9 or 8 of attending today, most of you are okay with the type of questions. These questions are very simple and direct, but while we're doing in classroom, we will have more different items and varieties which we will be discussing. And now I think I will ask you if you have any question about not necessarily today's presentation, overall about how we do the teaching and learning, what kind of engagement and what's your expectation, our expectations are. We will tell you everything during the induction week, which is the first week of year, almost 2 weeks before we start the program in October. But ideally, we'll tell you everything. Like I told you, we will do everything for you, and you do everything for us. Okay, you all try to get at least a very good distinction over 70, and stay engaged. Ask us if you need any help. We cannot read your mind. I used to read people's mind, but not anymore. So you have to tell what you want to do. You have to ask us and take any help you want at any time. Okay, so that's how you maximize your learning. We are there to help you in many ways, in whichever way you can, and you must take advantage of that. Law was saying something now in the chat, but I couldn't check her chat because I was presenting. I'll check that. Okay, guys, do you have any question for me?
I think we're at the end of the session now. So
Yeah.
if there are any questions, we would encourage you to contact us via email. I'm just going to pop that in the chat now if you've got any follow-up questions. I have also just posted in the chat a link to book one-to-one appointments. So we're offering 15-minute virtual appointments with our program and route leads. So you can book in to meet with Rama for 15 minutes one-to-one, or with Shayla, or any of our other program and route leads if you've got further questions or further things you'd like to discuss. So that link is in the chat now. I've just posted the email address as well. And with that, I think we're going to call it a day. So thank you so much, Rama. And thank you for attending, everybody. And we'll see you very soon.
Thank you all. Thanks.
Thank
Bye.
you.
Guys.
Bye-bye.